Hi, I'm Kayla Taylor and welcome to Kayla Tailored Wellness. I am a family nurse practitioner that specializes in integrative medicine. So that means that not only do I get to practice medicine in a clinic, but I also get to educate on preventative care, lifestyle changes, and get to customize holistic healthcare for patients' health conditions using supplements, vitamins, and botanicals. So just remember, I am not your healthcare provider, so any of the options I'm going to discuss today, I do want you to speak to your healthcare provider before you make any changes to your health regimen. So today I want to discuss what leaky gut syndrome is, how you would treat it with the elimination diet, and how you would repair your gut. Before we get started though, smash that like button and hit the subscribe button for the YouTube algorithm. So what is leaky gut? In between the intestinal wall, there are intestinal cells that are held together with tight junctions. With leaky gut, these tight junctions separate and allow for space in between the intestinal cells. So this can lead to intestinal permeability, allowing anything in and out of these intestinal cells, and that then leads to an inflammatory process. So intestinal permeability can be worsened by inflammation from potentially an inflammatory diet, microbiome changes such as bacterial overgrowth in the intestines, medications such as NSAIDs like Ibuprofen, Motrin, Aleve, stress, lack of exercise, ulcerative colitis, and even celiac disease. So signs that you have a leaky gut would include diarrhea, constipation, abdominal pain or discomfort, gas and bloating, halitosis, which is bad breath, fatigue, and even gastrointestinal infections that keep reoccurring. So tight junction dysfunction is associated with atopic dermatitis, such as eczema, and autoimmune disorders. You can improve these tight junction dysfunction by exercise, improving your diet, limiting stress, and the elimination diet. So why would you want to do an elimination diet? Allergy testing can be very limited and sometimes inaccurate. In order to get a positive response on an allergy test, you have to have an IgE reaction. And sometimes you have these symptoms, but you're not allergic to this particular food, but you still might be intolerant and it can still cause symptoms. So that's why an elimination diet can be more useful than allergy testing. So how do you do an elimination diet? You're gonna start by eliminating irritating foods. So that would include high fructose corn syrup, artificial sweeteners, sugar, eggs, milk, red meat, processed foods, caffeine, alcohol, and even wheat. So you're going to remove those from your diet for 3 to 4 weeks. Your symptoms should get better with time and should resolve. But just remember, some people get worsening symptoms in that first week. So once you have removed those foods from your diet, then you're gonna go ahead and gradually reintroduce one food at a time every 3 days. So on the first day, you're gonna do a little bit of that food and slowly increase the amount of food you do over those 3 days. You then wanna pay attention to your symptoms and how you respond to those foods. If you do get gastrointestinal symptoms from that food, then you know that you are intolerant and you should not have that food in your diet. If you don't have symptoms, that's great. Still remove that food from your diet until the elimination diet is over, and then you can bring it back into your everyday foods. So how do we repair the gut after this? So So if your healthcare provider determines that you have SIBO, which is small intestinal bowel overgrowth, and that would be determined through a breath test, then they would want to give you an antibiotic called rifaximin. So you could take 400 milligrams 3 times a day, and that will remove the bad bacteria from your gut. You'll then want to add back in the good bacteria in your gut. I would start with 25 billion bifidobacteria and lactobacillus for 4 to 6 weeks. Then you can go down to 10 billion every day. You'll then want to repair the gut with glutamine, fish oil, zinc, and vitamin C. So those will all be very anti-inflammatory for the gut, and they will repair mucosal injury. So comment below if there's been anything that has helped your leaky gut symptoms or any other health topics you'd like me to address. And please click on my affiliate link for competitive pricing on supplements. So thanks again for watching today, and thank you for letting me tailor your wellness.